Please be seated. I'm Terry Lenny, Senior Associate Dean in the UK College of Nursing. I would like to welcome you to the University of Kentucky College of Nursing's hooding ceremony for the 2021-2022 Masters and Doctoral Nursing graduates. As a courtesy to our graduates we are recognizing today, please turn off your cell phones and pagers for the duration of the ceremony. This event will be recorded and is also being live streamed on UK College of Nursing's YouTube. Okay, we're going to start this ceremony with a very special presentation. Dean Heath, will you please join me on the stage? Okay. It is my honor to introduce fellow nurse and our mayor, Linda Gorton, to come to the stage. Mayor Gorton.
So, a couple things. I first met Janie when she came here in 2014 and have loved her ever since. And I'm a 71 graduate of the University of Kentucky College of Nursing. So congratulations to all of you. You all. And Janie has been a wonderful role model and friend for me in leadership and in other ways. And earlier today at the pinning ceremony, I was able to actually surprise her with this. Now it's not a surprise, but it's just as deeply felt. So I have a proclamation, and this is for Dr. Janie Heath Day. Whereas Dr. Janie Heath, Dean and Warwick Professor of Nursing at the University of Kentucky College of Nursing since 2014, is retiring after 46 years in the nursing profession. And whereas during her tenure, Dean Heath has raised the national prominence of the college's academic programs with the Bachelor of Nursing, the Bachelor of Science in Nursing program, currently ranked 20th, and the Doctor of Nursing practice now ranked 4th among public universities nationwide. And whereas she has expanded the college's research portfolio to $36 million in active research and training awards, with a current ranking of 14th among the nation's public universities. And whereas since 2014, the number of graduates from undergraduate, graduate, and postgraduate certificate programs has increased, as has the retention rate for the undergraduate program. And whereas the college has achieved National Council licensure examination for registered nurses, first-time pass rates among the top in the state and the nation, averaging 98 to 100%. And whereas Dean Heath prioritized diversity and inclusion, including undergraduate enrollment for underrepresented minority students, now therefore I, Linda Gorton, Mayor of Lexington, with love and genuine admiration, do hereby declare May the 6th, 2022, Dean Janie Heath Day. Congratulations. No more surprises.
I'm glad we had a dry run.
Okay, now here, put this up here. And you get to keep this.
Thank you, Mayor Gorton. Now it is my honor to introduce Dr. Janie Heath, Dean and Warwick Professor of Nursing. Please join me in welcoming Dr. Heath.
Ooh, it's been a day. And I said, no crying, no crying. So thank you, Dr. Lenny. Platform party, college faculty members and staff, family and friends, and you, our graduates. It is indeed my honor to welcome you this morning to our annual hooding ceremony, a significant milestone for our 6 postgraduate certificate recipients, 8 Master of Science in Nursing Healthcare Leadership graduates, 36 Doctor of Nursing Practice graduates, and 7 Doctoral of Philosophy graduates. It is also my honor to extend greetings from President Eli Capilouto and Provost Robert DePaula, along with a special message to join us this evening at Rupp Arena for the University Commencement Exercise, when both graduate and undergraduate students of the college will be awarded their degrees. Before we begin, I want to acknowledge how amazing it is to see how full this stage is with so many of our very own alums. And it also looks like about 3/4 of UK nursing leadership is here on stage as well. But more importantly, I want to acknowledge all the nurses on this stage who made it here after enduring the hardest times of our lives with the pandemic. Besides our graduates, there are several distinguished guests and faculty on the stage whom I would like to recognize for the support that they have provided our graduates. When I call your name, please stand and remain standing, and I'm going to announce your names one row at a time. Dr. Terry Linney, Senior Associate Dean, Dr. Sheila Melander, Associate Dean of MSN and DNP Faculty and Practice Affairs, Dr. Tom Kelly, Associate Dean of Research and PhD Faculty Affairs, Dr. Debra Mosier, Assistant Dean of PhD Program of Studies and Scholarly Affairs, Dr. Deborah Hampton, Assistant Dean of MSN and DNP Program of Studies and Leadership Track Coordinator, and on the piano, Dr. Karen Butler, Assistant Dean of Academic Operations and Professor. We also have Dr. Evelyn Parrish, Assistant Dean of Accreditation and Strategic Outcomes and Associate Professor, and Dr. Sharon Locke, Assistant Dean of Faculty Practice, Director of Wilmore Faculty Practice, and full professor. Let's give them a round of applause, please. Next, I would like to ask Whitney Heat, President of the College of Nursing Alumni Association, to stand, and I will call also each of our DNP specialty track coordinators. Dr. Candace Falls, Adult Gero Acute Care NP Coordinator and Assistant Professor, Dr. Martha Biddle, Adult Gero Clinical Nurse Specialist Coordinator, Chair of Student Scholarly Affairs and Associate Professor, Dr. Elizabeth Tovar, Family Nurse Practitioner Coordinator and Associate Professor, Dr. Misty Ellis, Pediatric Acute Care Nurse Practitioner Coordinator and Assistant Professor, Dr. Leslie Scott, Pediatric Primary Care Nurse Practitioner Coordinator and Associate Professor, and Dr. Andrew Mikowski, Psychiatric Mental Health Nurse Practitioner Coordinator and Assistant Professor. Let's give them all a round of applause for their support. The Doctor of Nursing Practice and Doctor of Philosophy graduates will participate with faculty in the hooding ceremony. Both groups of graduates have earned a terminal doctoral degree in nursing, with the DNP emphasizing the scholarship of evidence-based nursing practice, and the PhD emphasizing the science of knowledge development in nursing. Doctoral preparation is a critical component of our land-grant, research-intensive university with an academic medical center. Through research, we are able to generate and disseminate groundbreaking knowledge applicable to not just individuals, but entire populations. This then allows for the development, utilization, and translation of knowledge across practices and in clinical settings, producing positive evidence-based practice outcomes. There is perhaps no other event in the life of a graduate student that compares with the gravity and the symbolism of this ceremony. The pageantry of the ceremony has its roots in medieval times, dating back to the tradition of Europe's first universities. In those early times, the dress of the student and scholar was that of a clergy, and the long gowns were likely worn for warmth. The hoods were worn to keep rain and snow off. In the United States, the academic dress has been continuous since colonial times, having been derived from traditions of early universities worldwide. The robe and the hood reflect the level of education, and the color in the hood represents the colors of the university that awards the degree. As you know, the colors of the University of Kentucky are blue and white, but what you may not know is that the colors were adopted in 1892. The color for nursing is apricot, as determined by the nursing faculty actually at Yale University in 1927, and this has been continuous since that time. To each graduate, we are exceedingly proud of your accomplishments and wish you the very best in your new journey as nurse scientists, scholarly advanced practice nurses, committed educators and mentors, and executive nurse leaders. Your years of hard work have finally paid off. You have earned this knowledge that will empower yourself and communities in the Commonwealth and beyond. At this time, I would like to recognize our wonderful faculty for their outstanding contributions they have made to research, teaching, and the service mission of the university and the college. Would all the nursing faculty on the stage please stand to be recognized? Go ahead. There we go. And last, but certainly not least, I extend my welcome to all family and friends who have joined us this weekend. We thank you for your love and support of these graduates and join you in celebrating their achievement. Thank you.
Thank you, Dean Heath. I would like to introduce Dr. Debra Hampton, Assistant Dean, MSN and DNP Programs, and Track Coordinator for the Leadership Option. Dr. Hampton will say a few words regarding the Master of Science in Nursing degree candidates. Dr. Hampton.
In the fall of 2019, the College of Nursing admitted 10 students to our Master's in Healthcare Systems Leadership Program. That was a new program. 8 of those students are graduating today with new knowledge and skills that will take them far as a leader. What is a leader? A leader is someone you will follow to a place you would not go by yourself, someone who inspires passion to achieve goals, who provides a vision and the path to realizing it, and who others want to follow. A leader inspires others to learn more, to do more, and to become more. As you hear the names of our master's students called today, know that you're meeting true leaders. And to our graduates, special recognition for your hard work to get to this point. I'd now like to invite Dr. Sheila Melander to the podium.
Thank you, Dr. Hampton. Will the master's students please line up behind me? And I'd like to invite Dean Heath to come forward to congratulate our Masters of Science in Nursing graduates as they walk across the stage. And I'd also like to invite Dr. Jennifer Miller, Dr. Elizabeth Tovar to come forward to assist faculty with hooding. Dr. Debra Hampton, will you come forward? Dr. Hampton will be hooding Ronald Dewar, MSN Healthcare Systems Leadership. MSN capstone project title, Continuing Progress Meetings Following Orientation for First-Year Graduate Nurses in the Emergency Department. Dr. Hampton will hood Stephanie Durbin, MSN Healthcare Systems Leadership. MSN capstone project title, Using Mitigation Planning and Situation Awareness to Prevent Cardiac Arrest in Hospitalized Pediatric Intensive Care Units. We're going to make some photo op adjustments and we'll be right back. Dr. Hampton will hood Andrea Noctegal, MSN Healthcare Systems Leadership, MSN Capstone Project Title, The Path to Employee Engagement Through Shared Governance. Will Dr. Karen Stefaniak come forward? Dr. Stefaniak will hood Madison Cole Burke, MSN Healthcare Systems Leadership, MSN Capstone Project Title, The Influence of Stress Responses on Operating Room Staff Performance and the Development of Effective Coping Mechanisms. Dr. Stefaniak will hood Anna Marcinko, MSN Healthcare Systems Leadership, MSN Capstone Project Title, Employee Self-Confidence and its Effect on Patient Satisfaction and Employee Engagement. Wardrobe malfunction. Will Dr. Karen Butler come forward? Dr. Butler will hood Keegan Chase, MSN Healthcare Systems Leadership, MSN Capstone Project Title, Calling for an Ambulatory Care Pediatric Clinical Nurse Specialist. Dr. Butler will also hood Kimberly Cundiff, MSN Healthcare Systems Leadership, MSN Capstone Project Title, Incorporation of a 2-Day Shadow into Nursing Orientation. At this time, will you please join me in congratulating our inaugural cohort of MSN Healthcare Systems Leadership graduates. We'll next move right into the recognition of our DNP graduates, or Doctor of Nursing Practice graduates. The Doctor of Nursing Practice program was started originally at the University of Kentucky in 2001. This was the first in the country under the guidance of Dr. Carolyn Williams, Dean and Faculty Emeritus, who was our Dean at that time. Due to the increased complexity of healthcare systems and increasing acuity of patients, the DNP was established to address the dynamic, ever-changing needs of our healthcare systems and to impact patient outcomes and improve the overall health of our communities. The impact of the work of these students is being felt across the country. As one example, one of our graduate students' intervention project will be implemented nationwide starting next week in over 250 facilities. So as you hear the titles of these DNP projects, it is with this intent that these graduates pursued their areas of clinical study. Now we'll recognize our DNP graduates. Will the first row of Doctor of Nursing Practice degree candidates please come forward? I'd like to invite Dean Heath. You are exactly where you need to be. And I'd like to invite Doctors Jennifer Miller and Doctors Elizabeth Tovar to come forward to assist faculty with hooding. And they are where they need to be. Will Dr. Karen Butler come forward? Dr. Karen Butler will hood Raymond Odell Young, post-MSN DNP Executive Leadership Specialty. DNP project title, Examining the Impact of Patient De-Escalation Techniques, Training on Nurses' Feelings of Safety. Will Dr. Martha Biddle please come forward? Dr. Biddle will hood Anna Rose, Adult Gerontology Clinical Nurse Specialist. Dr. Anna Rose is the last graduate of our Clinical Nurse Specialist program, and we would like to thank Dr. Martha Biddle for her leadership and her commitment to this program across the years. Dr. Anna Rose's title is Examining the Impact of a Protein Intervention to Improve Outcomes in Frail Perioperative Candidates, a Feasibility Study. Will Dr. Morgan Chernacki come forward? Dr. Chernacki will hood Natalie Shelf, Pediatric Primary Care Nurse Practitioner. D&P project title, Evaluation of a Beverage Educational Intervention for Latino Parents of Infants and Children ages 9 months to 5 years. Will Dr. Misty Ellis come forward? Dr. Ellis will hood Morgan Garrett, Pediatric Acute Care Nurse Practitioner. D&P project title, The Use of a Pediatric Palliative and Hospice Education Module to Enhance the Knowledge and Practice of ER Providers. Will Dr. Debra Hampton come forward? Dr. Hampton will hood Jill Marie Clemens, post-MSN D&P Executive Leadership. D&P project title, Exploring Palliative Care Education Needs and Desires of Advanced Practice Providers in the Critical Care Setting. Dr. Hampton will hood Sherry Ullery Griggs, Executive Leadership. D&P project title, Countering Moral Distress in ECMO Nurses with Case Review Debriefings. Dr. Hampton will hood Benjamin Hughes, post-MSN D&P Executive Leadership. D&P project title, The Measurement of the Impact of Well-Being Resources on Moral Distress Following the COVID-19 Pandemic in Frontline Nurse Leaders. Dr. Hampton will hood Jennifer Pepiet, post-MSN D&P Executive Leadership. D&P project title, The Effects of Cultural Competency Training on Providers' Knowledge, Skills, and Attitudes towards the Latino Population. Dr. Hampton will hood Elizabeth Smith, post-MSN D&P Executive Leadership. D&P project title, Evaluation of Dyad Effectiveness in a Psychiatric Healthcare Facility. Dr. Hampton will hood Tina Thomas, post-MSN D&P Executive Leadership. D&P project title, Huddle Implementation in the Perioperative Setting. Dr. Hampton will hood Mark Woods, post-MSN D&P Executive Leadership. D&P project title, The Effect of a Web-Based Training on Suicide Knowledge, Attitudes, and Health Access Behaviors of Behavioral Health Nurses Regarding Suicide Prevention. Will Dr. Andrew Mikowski come forward? Dr. Mikowski will hood Catherine Hughes, Psychiatric Mental Health Nurse Practitioner. D&P project title, Effectiveness of Substance Use Disorder Education on Knowledge and Attitudes Among Entry-Level Obstetric Nurses. Dr. Hampton, would you come forward?
Dr. Sheila Melander will hood Shelby Bliss, adult gerontology acute care nurse practitioner. Shelby's DNP project title is addressing the inpatient penicillin allergy, implementing a nurse-driven allergy assessment tool to enhance antimicrobial stewardship. Dr. Melander will also hood Kent Russell Brower, adult gerontology acute care nurse practitioner. His DNP project title is Caring for Ourselves Before We Care for Others, a mindfulness-based intervention for acute care nursing staff. Dr. Melander will hood Ashley J. Gilstrap, adult gerontology acute care nurse practitioner. Her project title is Decreasing Anxiety, Depression, and Suicidal Ideation through the implementation of education and screening at Chandler Medical Center. Dr. Melander will hood Arden Anastasia Gross, adult gerontology acute care nurse practitioner. Her project title is The Effects of an Educational Module on Perceived Knowledge, Perceived Barriers, and Attitudes Related to Sleep, Promoting Practices Among Bedside Nursing Staff Within a Medical ICU. Dr. Melander will hood Jenna McDonald Halpert, adult gerontology acute care nurse practitioner. Her DNP project title is Increasing Adherence to Protocolized Diuresis for de-resuscitation of ICU patients by increasing nursing knowledge and competence. Dr. Melander will hood Casey Mingy, adult gerontology acute care nurse practitioner. Casey's project title is A Multifaceted Approach to Improving Sedation Practices in the CV ICU. Dr. Melander will hood Megan Steele, adult gerontology acute care nurse practitioner. Her project title is The Impact of ICU Telemedicine on Patient Outcomes in the Surgical Critical Care Setting, an observational study. Dr. Melander will hood Megan Steckinger, adult gerontology acute care nurse practitioner. Megan's project title is Implementation of Education and a Screening Tool to Assess Palliative Care Needs in the Critical Care Setting. Dr. Melander will hood Carson Swartz, adult gerontology acute care nurse practitioner. Her project title is Increasing Staff Compliance with Routine HCV Screening and Improving Linkage to Care Among Patients Testing Hepatitis C Positive in the Emergency Department. Dr. Melander, will you return to the podium?
Will Dr. Julie Osage please come forward? Dr. Osage will hood Sydney Hahn, family nurse practitioner. DNP project title, Evaluating Providers' Knowledge, Attitudes, and Intentions Towards Assessing Pregnancy Desires in Women of Childbearing Age. Dr. Osage will hood Jacob Heil, family nurse practitioner. DNP project title, Tobacco Use Screening and Cessation Counseling in Primary Care. Dr. Osage will hood Christy McBride, Family Nurse Practitioner. DNP project title, Evaluating the Use of a Diet Screening Tool for Diabetes and Weight Management in Primary Care. Dr. Osage will hood Brittany Pittman Hardcorn, Family Nurse Practitioner. DNP project title, Effects of Tailored Colorectal Cancer Patient Education on Colorectal Cancer Screening Rates in an Urban Kentucky Clinic. Dr. Osage will hood Kate Rodriguez Garant, Family Nurse Practitioner. DNP project title, Increasing Medicare Wellness Visit Participation in a Primary Care Clinic. Would Dr. Evelyn Parrish please come forward? Dr. Parrish will hood Victoria Page Arnold, Psychiatric Mental Health Nurse Practitioner. DNP project title, The Effect of Education on the NIDA Modified Assist Tool on Knowledge and Screening for Substance Use Disorder among Clinicians. Dr. Parrish will hood Carolyn Bowman, Psychiatric Mental Health Nurse Practitioner. DNP project title, The Effect of an Educational Intervention on Attitudes Towards Behavioral Health Patients Among Medical Floor Nurses, a Pilot Study. Dr. Parrish will also hood Allie Carmichael, Psychiatric Mental Health Nurse Practitioner. DNP project title, Effectiveness of a Web-Based Smoking Cessation Training Program for Healthcare Professionals within an Acute Psychiatric Facility. I'd like to call Dr. Leslie Scott forward. Dr. Scott will hood Andrea Pauley, Pediatric Primary Care Nurse Practitioner. DNP project title, Improving the Healthcare Transition for Adolescents with Asthma, Implementing a Transition Readiness Assessment. I'd like to call Dr. Karen Stefaniak forward. Dr. Stefaniak will hood Corinne Huber Callahan, Post-MSN DNP Executive Leadership. DNP project title, Activating the Patient, a nurse-led coaching intervention to engage health information-seeking behaviors using the Ideal Discharge and Get Well Network. Dr. Stefaniak will hood Tana Elizabeth McKinney, Post-MSN DNP Executive Leadership. DNP project title, Clinical RN Attitudes Toward Shared Governance Programs. Dr. Stefaniak will also hood Mary Elizabeth Wethington, Post-MSN DNP Clinical Leadership. DNP project title, The Effect of Relational Aggression Training for New Emergency Department Nurses. Will Dr. Elizabeth Tovar come forward? Dr. Tovar will hood Stephanie Ann Cole, Family Nurse Practitioner. DNP project title, Screening for Severe Mental Illness in a Correctional Setting Using the Brief Jail Mental Health Screening Tool. Dr. Tovar will hood Christina Rademacher, family nurse practitioner. D&P project title, Evaluation of a Process Change on Mammography Screening Rates in a Family and Community Medicine Clinic. Dr. Tovar will hood Destiny Ryan, family nurse practitioner. D&P project title, Improving Smoking History Screening and Documentation to Increase Lung Cancer Screenings in Primary Care Clinics. Dr. Tovar will also hood Taylor Abner, family nurse practitioner. D&P project title, Using the SAM Score Questionnaire to Increase Skin Cancer Risk Screening at an Adult Annual Exam. Please join me in congratulating all of our 2021-2022 Doctor of Nursing Practice graduates. And it's now my pleasure to introduce Dr. Debra Moser, Assistant Dean of PhD Program and Student Scholarly Affairs, and Linda C. Gill, Endowed Professor. Dr. Moser will recognize the PhD graduates.
The PhD degree confers the status of Doctor of Philosophy. The term philosophy is translated in its original Greek meaning, from its original Greek meaning, love of wisdom. The PhD degree is the highest research credential that's offered in most disciplines, and it's bestowed only in those cases in which the recipient has been able to demonstrate the ability to conduct a program of scholarly work that results in a significant advancement or enhances the wisdom in their field of study. The students who are receiving their PhD degrees today have achieved that distinction through their scholarly efforts. They have contributed to expanding wisdom in the academic discipline of nursing. The titles of their PhD projects will provide some insight into the significant advances in knowledge that they have contributed through their efforts in this program. And while many PhD-prepared nurses are able to assume many important roles in society, first and foremost, they are scientists, researchers with a love of generating new knowledge upon which others can build or that directly impacts the health of individuals, families, and communities by preventing and managing illnesses. Now, to recognize our graduates, will the Doctor of Philosophy degree candidates please come forward? And I'd like to invite Dean Heath to come forward to congratulate our PhD graduates. And we have Jennifer and Dr. Tovar to assist. First, I'd like to ask Dr. Martha Biddle to please come forward. On behalf of myself and herself, who are co-chairs in Jung-hee's dissertation, Dr. Biddle will hood Jung-hee Kang. Her dissertation title is Dietary Assessments and Their Association with Physiologic Factors, Inflammation, and Cardiovascular Health Outcomes. So now I'd like to ask Dawn Prophet to come forward. Dawn's dissertation title was Describing and Predicting procedural anxiety in patients scheduled for advanced gastrointestinal endoscopy during the COVID-19 pandemic. Will Dr. Gia Mudd-Martin come forward? Dr. Mudd-Martin will hood Leanne Kuhnman, PhD graduate. Her dissertation title is Factors Associated with Lifestyle Management and Prevention of Type 2 Diabetes. And now I'd like you all to please join me in congratulating our 2021-2022 PhD graduates.
It is now my pleasure to introduce Ms. Whitney Heat, President of the College of Nursing Alumni Association.
Well, on behalf of UK and the College of Nursing Alumni Association, I just want to say congratulations to the May 2022 graduates and all of their accomplishments. I'd like to ask Dean Heath, Dr. Debra Hampton, and Dr. Sheila Melandry to join me in congratulating the recipient of the Presidential Award. The Presidential Award is given to a master's graduate who has demonstrated support and had significant impact in the advanced nursing practice, has mentored nursing students and colleagues in the healthcare profession, and demonstrated involvement in professional nursing organizations. This year's recipient is a member of multiple organizations and committees such as the Emergency Nursing Association and the ER Retention Committee. He has been an exceptional student and focused on his capstone project on ways to improve the adoption of new ER nurses in our ER roles and to maximize the benefit of new ER employee orientation. On behalf of the College of Nursing Alumni Association, we are pleased to present the May 2022 Presidential Award to Ronald Dewar. The next award is the Sebastian Stanhope Award. The Sebastian Stanhope Award is given to a DNP graduate who has demonstrated scholarly activity at the national, regional, and local level with educational presentations, publications, and/or grant funding for research. Has mentored nursing students and colleagues in the healthcare professions and has demonstrated involvement in the professional organizations. This year's recipient is a DNP graduate from the Family Nurse Practitioner track and has a remarkable graduate academic career. During his time in the DNP program, he was the PI on a funded research pilot project in the UK Chandler Emergency Department, presented a webinar on acute coronary syndrome in the ED at the Gill Heart and Vascular Institute, and presented the OB trauma prevention case review at the UK Healthcare Key to Trauma Care in the Nurse Education Series. On behalf of the College of Nursing Alumni Association, we are pleased to present the May 2022 Sebastian Stanhope Award to Dr. Jacobs Heil. Okay, for the next award is the Carolyn A. Williams Award, and I would like to invite Dean Heath, Dr. Debra Mosier, and Dr. Tom Kelly to join us at the podium in congratulating the recipient. This award, the Carolyn A. Williams Award, is given to a PhD graduate who has demonstrated scholarly activity at the national, regional, and local level with educational presentations, publications, and/or grant funding and research, has mentored nursing students and colleagues in the healthcare professions, and has demonstrated involvement in the professional organizations. This year's recipient is an outstanding mentor to other students and exceptional student scholar. All in the PhD program, she has worked as a research assistant and continued her work as a research associate in her postdoctoral fellowship at the Rich Hart program. On behalf of the College of Nursing Alumni Association, we are pleased to present the May 2022 Carolyn A. Williams Award to Dr. John E. Kane.
Thank you, Whitney, and congratulations to all of our awardees. Let's give them a round of applause. Just a few minutes ago, we were pinning our new generation of nurses right here in this facility. Now we have hooded our new generation of masters and doctorally prepared nurses. I would like to ask you to give a round of applause to them as well. Now, this class knows that this will be my last hooding ceremony, as after 46 years of a truly blessed and amazing career in nursing, I will be retiring. So as we embark on our similar new beginnings paths, you guys will not be surprised for me to remind you one last time to read to lead. Remember? And remember quotes from my favorite scholar, Dr. Seuss, especially, "Oh, the places you'll go." 31 years ago, I was hooded with my master's degree, and then 13 years later, I was hooded with my PhD degree. So I know all so well how your heart is filled with happiness and gratitude. And even though I know my next place to be is going to be with 5 grandchildren, it's got it written all over my calendar already, I have a pretty good idea where your next place will be, and that's joining more than 4.2 million RNs as an elite group with advanced and/or terminal degrees to save lives, transform communities, and inspire hope. How fitting it is as we get ready to celebrate Nurses Week to close with a quote from Florence Nightingale. "Never lose an opportunity of urging a practical beginning, however small, for it is wonderful how often in such matters the mustard seed germinates and roots itself." Let's collectively pay it forward in honor of Flo and your soon-to-be retired dean, lights, camera, and action, to revolutionize healthcare delivery and promote the highest levels of wellness in diverse populations, one patient at a time, one student at a time, one research study at a time, one leadership position at a time, and one published paper and grant at a time. I offer my gratitude for your commitment to make it pop as scholarly leaders, educators, practitioners, and researchers dedicated to always soaring high with nursing excellence and staying ground with our nursing values. The scholarship you have accomplished, the challenges you have conquered, and the goals you have reached and even surpassed are nothing short of extraordinary. You, your families, and your friends should be very proud today and very hopeful for all the possibilities of the future that are open to you. Before we close this ceremony, I would like to ask for a round of applause in appreciation of the beautiful music and talent of one of our very own faculty, Dr. Karen Butler. And I would also like to recognize Kathy Collins and her team for keeping us organized and on time. And finally, I would like to recognize Dr. Sharon Locke, as this will be her last hooding ceremony as well. After 25 years of service at the University of Kentucky, she will be retiring as well. Dr. Locke's efforts to help start the first DNP program in the country and advance access to primary care services through faculty practice are outstanding. Dr. Locke, would you please stand so we can recognize your extraordinary contributions to the Academy and the profession and Wilmore, Kentucky. Congratulations, class of May 2022 again. May you always cherish your graduate education years here at UK and continue striving to inspire hope, transform communities, and save lives. And know there has been no higher honor in my entire nursing career than to serve as your dean. This concludes the hooding ceremony for the University of Kentucky's College of Nursing. And I would just like to ask all the audience just to wait, because we're going to do a group picture. And I believe that we've got some gifts that we want to give each of you, so make sure you walk out the door. It's not a Lexus. I know I was always promising you guys that, but I'm sure your family's going to have that for you when you get out there. So at this time, if everyone would please stand, faculty will recess out first, and then our graduates will. So I want to just remind everybody that at 6 o'clock, we've got commencement at 6 o'clock at Rupp. The whole world will know nursing is in the house, so I hope you will join us. Thank you.